Good morning, students. Today we'll talk about the histology of the pulp. In the previous sessions, we talked about the enamel, the dentine, and in this session, we will talk about the pulp. At first, we have to talk about the anatomical parts of the pulp. Pulp is divided into two parts: coronal pulp and radicular pulp. The coronal pulp is the pulp which is found in the area of the pulp chamber in the crown region, and the radicular pulp which is found in the roots of the teeth. And at the end of the root there is the apical foramen where the blood vessels and nerves enters inside the pulp. This is a diagram for the pulp region. From the previous session, we talked about the odontoblasts layer, and the area immediately after it is the pre-dentine area. Then I have the dentine. According to the odontoblastic layer, the pulp is divided into sub-odontoblastic layer below this odontoblastic layer and supra-odontoblastic layer, and the pulp proper, or the core of the pulp. This is a decalcified section showing us all the regions of the pulp. We have the odontoblast layer, we studied in the last week, the predentine and the dentine. The area below the odontoblastic layer is called the sub-odontoblastic layer and is composed of two parts: cell-free zone and cell-rich zone. Cell-free zone also can be called cell-free zone of well, a well-free zone. Also we can call it cell-poor zone. And then I have the cell-rich zone, the pulp proper, or the core of the pulp. The supraodontoblastic layer, we will talk about it in later images. Why we call this cell-free zone? Why it is called the cell-free zone? Or another name, nuclei-free zone. Because we cannot see any cells in this area, and there are processes passes through this cell-free zone. What type of processes that we can see in this free zone? We have the nerve fibers, we have the processes of antigen presenting cells, and processes of fibroblast. Cell-rich zone. Why it is called cell-rich zone? Because it is rich with different types of cells. What type of cells that we can see? We have to remember that the pulp is a specialized connective tissue. Go to the theory and see why it is specialized. Going back, cell-rich zone. Why it is called cell-rich zone? Because it is rich with different types of cells. What cells that we can see in the cell-rich zone? We can see the fibroblasts, which are the dominant cells in the body. We have stem cells, we have defense cells, we have macrophages, we have antigen presenting cells, we have endothelial cells, mast cells, T lymphocytes, different types of cells that we can see in this region. The pulp proper, or the pulp core, the predominant cell is the fibroblasts, and then we have a ground substance. We have a ground substance in the pulp, different types of fibers. We can see the blood vessels, and we can see the nerve fibers. This is another diagram showing us the dentine, the predentine, the odontoblastic layer, the cell-free zone, and the cell-rich zone. This is the cell-free zone. and this is the cell-rich zone, and this is the pulp core or the pulp proper. The odontoplastic layer looks as it is pseudostratified. We have to remember that the odontoplast layer, the cells of the odontoplast, are single layer around the periphery of the pulp chamber, but because of the sectioning of the soft tissue, it looks like pseudostratified cells. The shape of the odontoplastic cells are columnar in shape in the crown region. So in the crown, odontoplasts are columnar in shape. In the root area, cervical and the middle part of the root, the odontoplast cells are cuboidal in shape, and in the apical third of the root, the odontoplast cells are flat. How can we differentiate that this section is taken from the crown region or the root region? We have to look for the cell-free zone. We can see the cell-free zone clearly in the crown region, while in the root region the cell-free zone is absent or it is linear in shape. We cannot identify it easily. So if I give you any section and ask you from where the section is taken, look at the odontoplastic layer and look at the cell-free zone. If the odontoplasts are columnar in shape and there is a cell-free zone, so it is from the crown region. If I cannot see the cell-free zone and the cells are cuboidal odontoplastic cells, so this section is taken from the root region. In this picture we can identify the supraodontoplastic layer. Here is the odontoplasts, here is the periodontium, calcification front, and the dentine. These spaces between the odontoplasts is called the supraodontoplastic layer. It is not truly present. It is due to shrinkage of the odontoplastic cells or the cells during the preparation of the specimen. So this area, these spaces are the supraodontoplastic layer of the pulp. So we can divide the regions of the pulp according to the odontoplastic layer into supraodontoplastic layer between the cells of the odontoplast and subodontoplastic layer below the odontoplast. The subodontoplastic layer is divided into two parts: cell-free zone or cell-free zone of well, or cell-poor zone or nuclei-free zone. And number two, the cell-rich zone. Then I have the pulp core or the pulp proper. The cell-free zone provides space for the movement of the odontoplasts. The cell-free zone provides space for movement of the odontoplasts while they are producing the secondary dentine. Look at this image. Here I can see the bulk of the pulp, the core of the pulp. I can identify the dentine, the odontoplastic layer, and here I can see the cell-rich zone. Here is the cell-rich zone. I cannot see the cell-free zone, meaning that this section is taken from the root. Going back to this image, what you can see, just in histology, describe the things that are in front of you. We have small spots here. These spots are the cells which are dominant in the pulp, which are the fibroblasts. Look at this structure and this structure. These structures have lumens. Which structures have lumens? These are the blood vessels. Blood vessels have lumens. Blood enters the root through arteries and veins. Once they are in the roots and the pulp, we call them arterioles and venules. How can I differentiate between the artery and the venule? If the structure in front of me, I identified it that it is a blood vessel, the wall is highlighted or well demarcated, it is an arteriole. If the wall is faint and not clear, like this, it is a venule. Sometimes we can see blood clots, like this, inside the arteries or the venule. Look at this one. I have a faint wall, thin, it is a venule. Look at this. The wall is well demarcated. It is an arteriole. Here is the lumen, and here is the blood clot inside this blood vessel. Here is another venule. Here is another venule. Here is another venule. At the end of the arteries, there will be blood capillaries, which will collect blood and go back through the venules, giving us capillary plexus. This capillary plexus is seen in the subodontoplastic region. So any blood vessel in the subodontoplastic region, it is a capillary. We call it capillary. Arterioles and venules inside the core of the pulp. In the subodontoplastic region, these are the capillaries, like this. This is a higher magnification. Dentium, predentium. This is the dentium, the predentium, odontoplastic layer, the cell-free zone, which is very thin and narrow, which meaning that this section is taken from the root. And here I can see the blood vessels. These blood vessels in the subodontoplastic region, we call them blood capillaries. In the pulp core, these are the venules. Look at the structure. It doesn't have a well demarcated line or a highlighted line. So this is a venule. The endings here in the subodontoplastic region, we call them capillaries. This is a higher magnification. Look at the blood capillaries or capillary plexus in the subodontoplastic region. This image showing us the distribution of the blood vessels inside the pulp after injecting the blood vessel with a special ink, Indian ink. You can see the arteries, arterioles and venules, and at the end we can see the plexus. This is the plexus, capillary plexus, in the region of the subodontoplastic layer. This is a diagram. The blood vessels enters through the apical foramen. These are the arterioles and the venules. At the periphery, they are dividing into blood capillaries. Look at this image. What you can see here, you can see that this section is taken from the root because I have the odontoplastic layer. I cannot see the free zone, cell-free zone. I can see the rich zone, and then I have the pulp proper, dentium, and it is layers. Structures with lumens. This one are venule. This is another venule. I cannot see here arterioles, but I can see fibers. These are the fibers, and here are other fibers. These are the nerve bundles, and the section here runs through these nerve bundles or fibers longitudinally. Look at this structure. This structure is a solid structure. It doesn't have a lumen, and there are spots inside it, dark and light spots. This structure is a nerve bundle, but the section runs through it at right angle. Why does it have light and dark spots inside it? Because the nerves which runs in the human body, either myelinated or unmyelinated nerves. The spots which are darker in color, these are the myelinated nerves. The lighter ones are the unmyelinated nerves. This is higher magnification. We can identify the venule. We can identify the nerve fibers. Section longitudinal runs through them, and this is the solid structure which doesn't have a lumen and having here the dark spots and some light spots inside, which are the myelinated and the non-myelinated nerves. Look at this view. We can see the dentine, the layers of the dentine, no cell-free zone or short line. This is taken from the root. This is the cell-rich zone, and this is the pulp proper. What structures that we can see? We can see structures with lumens like this. A highlighted wall, it is arteriole, 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 and we can see structures like this with lumen, and the wall is not highlighted. It is a venule. This is another venule. This is an arteriole. And look at this structure. This structure is solid with light and dark spots inside it. This is a nerve bundle. This is a higher magnification. You can see the spots as we said earlier. We have light areas, venules. This is another venule. And here the highlighted areas with lumen, the arterioles. This is another arteriole, and this is the solid structure, which is the nerve bundle, nerve fibers with light and dark spots. This complex, we call it neurovascular complex. Neurovascular complex. We have nerve fibers with blood vessels running along their course. Neurovascular bundle. This is the neurovascular bundle where we have arterioles and venules and the nerve fibers. The section in these nerve fibers was a triangle. Inside we have the dark and light spots, which are the myelinated and the unmyelinated cells. This is the neurovascular bundle with arterioles, venules, arteriole, and the nerve fibers. Here we can see the distribution of the nerve fibers. These are the nerve fibers. Their ends, like the arterioles and the venules, in the arteries and veins, in the subodontoplastic region, we have the blood capillaries. For nerves, we have a nerve plexus in the subodontoplastic region and the supraodontoplastic region. The nerve plexus in the supraodontoplastic region, we call it nerve plexus of Bradlow, and the nerve plexus in the subodontoplastic region, we call it nerve plexus of Raschkow. Nerve fibers will enter between the odontoplasts in the predentine and enters inside the dentinal tubules and runs with the odontoplastic process for short distance. Here we can see the distribution of the nerve plexus in the subodontoplastic region and also in the supraodontoplastic region, nerve plexus of Bradlow, nerve plexus of Raschkow, and these fibers enter the dentinal tubules with the odontoplastic process. Here special staining to see the nerve fibers as bundles in the roots and in the crown region, while at the periphery they will give us the nerve plexus, and you can see here that these plexus or these nerve fibers entering inside the dentinal tubules for short distance, which are responsible for pain sensation or sensation of the tooth. Here is another image or special staining. These are the nerve bundles or fibers. You can see the nerve plexus in the subodontoplastic region, in the supraodontoplastic region, and inside the dentinal tubules. This image, we can see the dentine, the odontoplastic layer, the cell-free zone, and the cell-rich zone, and the pulp core. You can see the fibroblasts, which are the dominant cells. One of the aging processes that we can see is the decrease in the number of the fibroblasts. If I ask you, is this image of a young pulp or an old person? You can say it is an young pulp. Why? Because I can see many abundant type of cells, abundant number of cells. If I can see less number of cells and the ground substance is more, meaning that this is an old person. Depending on the section in front of me, if I can see abundant number of cells, meaning that this is a young pulp. If I can see less number and more ground substance, meaning that this is an old pulp, you can here identify the blood vessels in the roots, arterioles and venules in the bulk of the core of the pulp. This is a special staining for the nerve fibers. We can see the nerve plexus in the subodontoplastic region and in the supraodontoplastic region, and you can see here that the nerve fibers are entering the predentine to the dentinal tubules and runs with the odontoplastic processes. Here we can see the nerve fibers in the predentine region, and some will enter the dentinal tubules. This image shows us how the nerve fibers and their distributions in the root and the crown region. They enter as bundles. In the root, the periphery, less division, less nerve plexus, and you can identify that the branching of the nerve plexus at the tips of the cusps and in the incisal regions is much more than the flat surfaces of the crown. This is a electron microscope image. We can see the nerve bundles. We can identify the non-myelinated and the myelinated nerve fibers, and the cells which accompanying them is the Schwann cell, which is responsible for the production of the melanin sheath for the nerve fibers. This is a cross-section in the dentine in the area close to the pulp. We can see the dentinal tubule. What runs with the dentinal tubule? We can identify the odontoplastic process and the nerve fibers. These are the nerve fibers. Look at this tubule. We have the process only. In this, we can see the nerve fibers and the odontoplastic process, which means that if the section is taken close to the pulp, we can see or identify the process and the nerve fibers running with them. Not in all the dentinal tubules. It is not necessary to see nerve fibers in all the dentinal tubules. This is a section where we can identify the blood vessels, venule, and here is the nerve bundle with myelinated and non-myelinated nerves, and this is the IC immunocompetent cell, large multinucleated cell. Look at this image. You can what are the structures that you can see in front of you? You can identify B, the cell-free zone, A, odontoplastic layer. Here is the cell-rich zone, and C is the nerve fibers. What are the structures that you can identify? A, nerve bundle or nerve fibers, B, blood vessel, C, fibroblasts. This tissue is highly cellular, which means it is for a young person. Look at this image. What are the structures that you can identify? D, the dentine, B, the odontoplastic layer, C, cell-free zone, A, cell-rich zone. And below A, we have the pulp core or pulp proper. By that, we have completed the pulp. Now, what are structures that we may see different inside the pulp? Sometimes we can see what we call them pulp stones or denticles. Pulp stone or denticles. What are the pulp stones or denticles? The pulp stones or denticles are areas of mineralization or calcification, hard structure found inside the pulp core or the pulp proper. And these are divided into true and false pulp stones. True pulp stone is resembling the dentine, where we have odontoblast-like cells producing dentine as it is all featured. We have dentinal tubules, and we have cell, and we have predentine. This is a true pulp stone. The false pulp stone, we have concentric calcification, like circles, like a cross section in onion. Concentric calcification. We don't have dentinal tubules, and we don't have odontoblast-like cells. This is the false pulp stone. This is another false pulp stone. These pulp stones either runs free inside the pulp core. Sometimes they may be attached to the wall of the dentine. In this case, we call them attached pulp stones. By depositioning of the secondary dentine, they may become embedded inside the dentine. We call them embedded pulp stone. This is a sign of aging. By aging, the number of pulp stones is more than young birth. So one sign of aging is increase or the presence of pulp stones. Look at this structure. This structure, if you look to the dentine, it has the same color, the same consistency. At the peripheries, we can see the odontoblast-like cells, and these cells will give the dentinal tubules, predentine, and the same layers of the pulp, and it is free inside the pulp. So it is a free pulp stone. This is a higher magnification. These are the cells at the periphery. Here I can see the tubules. This is a true pulp stone. This is another pulp stone, also it is free. This is a true. These areas are because of the folding of the specimen. Due to the folding of the specimen, you can see the structure is resembling the dentine. Here I can see the odontoblast-like cells. This is the predentine, and here I have the dentine. This is the false pulp stone. I have concentric calcification, like circles, like a cross-section of a tree or an onion. And this is resembling the bone. This is, we call it the false pulp stone. Look at the number of these pulp stones inside the pulp. This is an attached pulp stone, a false attached pulp stone. This is another pulp stone attached. Also, we can see sometimes dystrophic calcification, spicules of which are tiny spicules of mineralization. Usually you see them around blood vessels and fibers, collagen fibers of the pulp. Dystrophic calcification or diffuse calcification around blood vessels and fibers of the pulp. Look at this calcification. This is a dystrophic calcification. Spicules of calcification, single or multi, inside usually the root region more. Here in the root region you can see these tiny spicules of calcifications or mineralization around blood vessels or fibers, nerve fibers or fibers of the pulp. This, if we take an image, an X-ray image, it will give an appearance which we call it snowstorm appearance. Snowstorm appearance, like the snow. Look at these spicules of mineralization or calcifications. Diffused calcification, not specific in one area. It is diffused, usually around blood vessels and fibers. This is what we call the snowstorm appearance in X-ray. In this image we can identify this is the embedded pulp stone. Embedded pulp stone. Longitudinal section, you can see the size of the pulp stone. Here you can see the size of the pulp stones. These pulp stones, as long as they are moving free inside the pulp, they will not make any problem for us. But the problem rises when these pulp stones compress a blood vessel or a nerve. fibers, they will lead to pain. Otherwise, there is no problem from their presence inside the pulp. And if the pulp was infected, these pulp stones will make a problem for the root canal treatment. They will obliterate the root canal. So they will make problem for the person who will make root canal treatment. In the end, we will summarize the pulp as follows. The pulp is divided into pulp core, pulp proper. According to the odontoplastic layer, it is divided into sub-odontoplastic layer and supra-odontoplastic layer. The sub-odontoplastic layer has two parts, cell-free zone and cell-rich zone. The cell-free zone may be named as cell-free zone of well or nuclei-free zone or cell-poor zone. Many processes runs through this zone, processes of fibroblasts, antigen-presenting cells, and nerve fibers. Then I have the odontoplastic layer. Then I have the supra-odontoplastic layer. The supra-odontoplastic layer is an artifact. It is not true, and it lies between the cells of the odontoblasts. Blood enters as arteries and veins. Once it is in the pulp, we call them arterioles and venules. Endings at the subodontoplastic region, we call them blood capillaries. How to identify arteriole from venule? If the wall of the lumen is well demarcated or highlighted, it is an arteriole. If it is faint, it is a venule. Also, I have nerve fibers enters the pulp as bundles. These bundles at the periphery, they will give us nerve plexus. This nerve plexus in the subodontoplastic region, we call it nerve plexus of Raschkow. In the supra-odontoplastic layer, we call it nerve plexus of Bradlow. Nerve fibers enters the dentinal tubules with the odontoplastic process in short distance. So if we have a section close to the pulp, meaning that this section is taken from, and we saw the odontoplastic process and the nerve fibers, meaning that this section is close to the pulp. If we do not see nerve fibers or odontoblasts, meaning that this section is taken far away from the pulp. Aging. By aging, what happens to the pulp? Number one, the size of the pulp will decrease. Why? Because of the continuity or production of secondary dentin. The size of the pulp will become much smaller. Number one. Number two, the cellularity will decrease and the fibrosity will increase, meaning that the ground substance which will be more. The number of cells will decrease. Vascularity will decrease. Innervation will decrease. Presence of pulp stones or dystrophic calcifications are all of aging. Also the presence of the transparent dentin, which is normal physiological process. The increase in the size of the peritubular dentin, leading to sclerosis of the dentinal tubules. All these are signs of aging for the tooth. I hope you enjoyed my lecture. See you